This meeting is now being recorded.
Hello and welcome to your open enrollment presentation for the 2019-2020 plan year. My name is Tiffany Hill and I work with Brown & Brown Insurance, and we are your employee benefits broker. So today's presentation will provide you with a high-level overview of each one of the plans that are provided to you through your employee benefits program. Since this is your open enrollment period, remember this is your one time per year that you do have access to be able to make changes to your plans. You'll be able to start making changes to your plans as of October 28th, and you'll have until November 8th of this year to be able to make changes. If you do decide to make changes, those changes will go into effect December 1st of 2019 and go through November 30th of 2020. Just so that everybody is aware, this presentation is for out-of-state exempt employees. If you're following along in your Benefits at a Glance booklet, you will see on page number 2, there is some general information that provides you with some commonly used insurance terms. This will make a little bit more sense as we go through the plans, and I'll be sure to elaborate more on these. So I mentioned this is your open enrollment period, and this is that time each year that you can make changes to your benefits. Outside of this period, you're really kind of locked in or locked out with the elections that you make during this period, unless you have what's called a qualifying life event. So qualifying life event would allow you to make changes outside of the normal open enrollment period. And some examples of these would be getting married, getting divorced, having a child, or maybe you have a change in employment status that would allow you to adjust your benefits. If you do experience one of these situations, then you must contact Human Resources within 30 days of the event to be able to successfully make changes to your benefits. The other thing I wanted to mention on page number 3 is we have set up an email box here at Brown & Brown for any open enrollment questions. So if after this presentation you have any questions about any of the plans that are offered to you, please just send an email to roigquestions@bbdaytona.com. So the following page, which is page number 4, provides you with some information on your member portal through Florida Blue. So if you're already enrolled in one of the 2 Florida Blue plans and you haven't already registered, I would suggest just taking a few minutes and registering on My Blue Service. So what My Blue Service is a personalized web portal that allows you access to all of your information and your plan details with Florida Blue. You obviously have access to that 24 hours a day, 7 days a week, and you can do things like check the status of your claims, look at your plan benefits, order new ID cards, or access any kind of claim forms. You can also obviously look up doctors and where the nearest facilities are to you. So certainly take a few minutes and register for that if you haven't already done so. A lot of the same great features that are on My Blue Service are also on the Florida Blue mobile app. So again, if you have a smartphone and you already haven't downloaded the Florida Blue mobile app, it probably would be in your best interest to do that, just in the case that you're on the go and you need access to your ID card or you need access to any plan information or your provider directory. You can do all of that on the Florida Blue mobile app. The other couple things I wanted to mention on this page, we've got Blue 365, which is the discount program through Florida Blue. That allows you access to different health and wellness discount programs such as vision care, also things like hearing devices, weight management programs. The one that's very popular is the Tivy Health Fitness Center discount program, which allows you access to their network of gyms, which is a nationwide network for $29 a month. So you have a sign-on fee of $29, and then it's $29 every single month. So again, register on www.blue365deals.com. For those of you that are looking for support and information in terms of bettering your health and wellness, you do have access to health coaches through Florida Blue as a member. And then there's a lot of great tools that you can access for information on, various clinical topics, different kinds of medications, and a lot of great resources and support if you're somebody that's really trying to better your health. So now let's take a look at your 2 medical plan options that you have available to you. As you can see, these are both Blue Options plans, and Blue Options plans indicates that you do have access to out-of-network coverage. So both plans are considered PPOs, and you can use them out-of-network. For both plans, we don't typically suggest that you use them out-of-network because your deductibles go up as well as your annual out-of-pocket maximum. So what that means for you as the member is your expenses typically are going to be higher out-of-network, but just know you do have access to those benefits. I'm going to start with the middle column, which is the Blue Options HSA plan. And this plan is the only plan that allows you the capability to be able to put aside pre-tax dollars into a health savings account. I'll talk to you a little bit more about the health savings account after this. So the first thing I wanted to mention, and this actually covers both plans, is that both plans provide 100% coverage on preventive care. So if you're somebody that doesn't really use your health insurance that often, please make sure you're using it for at least the preventive care. That's your routine physicals, your routine blood work, well woman exams, things like that. Both plans would provide 100% coverage for those types of visits. And that's a great opportunity for you to be able to establish a relationship with your primary care doctor and get some baseline data about your health that hopefully can help stop some small risks from turning into larger health conditions. So on this first plan, the Blue Options HSA, outside of preventive care, all other services as well as prescriptions would be subject to the deductible. So this type of plan can be easily explained in 3 different phases. So let's say you join this plan and you haven't yet met your deductible. What that means is all of your activity on the plan, whether you're having medical services or you have a prescription, would be subject to the deductible. So that means that basically you're paying the full cost of those services and prescriptions until you've met either your $1,500 employee-only deductible or your $3,000 family deductible. Now, keep in mind, if you have any dependents on the plan, you do want to pay more attention to the family deductible in this plan. That's the number you're going to have to meet before you move to co-insurance. So even if it's just you plus your spouse, either you collectively as a group, the 2 of you would have to meet $3,000, or one of you would have to meet $3,000 before you move to co-insurance. So remember, all of your doctor's visits, your urgent care, hospital, it doesn't matter what you're having done on this plan, you would be paying the full cost up to your deductible. And then once you meet your deductible, you would move into the second phase of this plan, which is what we call co-insurance. So co-insurance is basically the amount that's going to be paid after the deductible has been met. And that number on this plan is 20%. So once you've met your deductible, instead of you having to pay 100%, you're now only responsible for 20% of the cost. The other 80% of the cost would be paid for by Florida Blue. The third phase of this plan is meeting your annual out-of-pocket maximum. And remember, that number is somewhat like your worst case scenario. It's kind of like your catastrophic number, that in the event that you meet it, then all other covered medical expenses for the remainder of the calendar year would be paid for by Florida Blue. So your deductible is part of this number, your co-insurance is part of this number, and any kind of spending that you do in terms of prescription is also part of this number. So that number for this plan is $4,500 for anybody that has employee-only coverage. If you have any dependents on the plan, then it's $6,850 per person. And then if multiple people have contributed towards that annual out-of-pocket maximum, the family out-of-pocket maximum is $9,000. Again, if you meet this number, and let's say you meet it in May of next year, then for the remainder of the calendar year, all other covered medical services would be paid for by Florida Blue. The last thing I want to mention on this plan is that you do have a prescription drug plan. Remember, the cost of your prescriptions will be subject to the deductible. So on this plan, sometimes your prescription drugs can be somewhat costly until you've met your deductible. Now, once you meet your deductible on this plan, your cost would then turn to copays for your prescriptions, with generics being a $10 copay, preferred brand being $50, and non-preferred being $80. Again, at the very bottom, you have your non-network deductible annual out-of-pocket maximum and co-insurance amounts. While we do let you know that you have access to the out-of-network coverage, again, we don't typically suggest that you do that because your out-of-pocket expenses will be higher. So that's your first plan option. Your second plan option is going to be on the far right column, and that's going to be your blue option 05786 plan. So again, just to reiterate, your preventive care is covered at 100% as well on this plan. And then the biggest difference that I see between these two plans is that this plan has copay amounts that you're going to pay for most services that would be done using a health insurance plan. For example, you have copays on all of your doctor's visits. So a primary care visit would cost you $25, and then specialist and chiropractic care would be a $45 copay. You also have copays on your emergency room and urgent care visits, as well as all of your diagnostic services. So keep in mind, copays are just flat dollar amounts that you're going to pay each time you have that particular service being performed. Copays do not track towards deductibles. They're completely separate, but what they do track towards is your annual out-of-pocket maximum. So on this plan, you do have a deductible of $1,000 for individual and $3,000 for family, and your annual out-of-pocket maximum is $4,000 for individual and $8,000 for family. Again, those two numbers, the annual out-of-pocket maximum for both individual and family, represents your worst case scenario, and every time you reach into your pocket to spend a dollar, those dollars are all tracking towards that big number. On the very bottom, you'll notice your prescription drug plan is pretty much the same as the first plan we talked about, but you do not need to meet your deductible first before having copays on your prescription. So from day one, if you're on this plan, December 1st of this year, you'll have a $10, $50, or $80 copay for your prescription. So I mentioned I'd covered the health savings account and tell you a little bit more about how that account works with the first plan. So remember, the only plan you can have this health savings account with is that first plan we talked about that has all services and prescriptions subject to the deductible plus coinsurance. So what exactly is a health savings account? A health savings account, which we also call an HSA, is a bank account that is in your name that you can put aside pre-tax dollars into to pay for qualified medical, dental, or vision expenses. So I mentioned that the contribution is a pre-tax contribution. So what that means is when the money comes out of your paycheck has not been taxed yet. So this contribution into the health savings account actually lowers your taxable income, which means you're paying less taxes on the income that you're earning. So I also mentioned that this is an actual bank account, so you will get a debit card. This is through Optum Bank. And when you need to use the money that's in the account, you can use it for anything medical, dental, or vision related. And you'll have a debit card that you'll swipe just like your bank debit card. This is an employee-owned account, so in the event that you ever leave your employer or you retire, you'll take this account with you and the funds never expire. So the good thing about a health savings account is that at the end of the year, if you still have money saved in the account, you never lose the money. It's yours forever and it just rolls over to the next year. This is an IRS governed account, so first and foremost, you do have to use it on qualified medical, dental, and vision expenses. Publication 502, which is an IRS publication, does provide a complete list of qualified medical expenses, but we have listed some samples of things that you can use it for on page 6 in your Benefits at a Glance booklet. The other thing that you need to be aware of is there are some contribution limits for the year. The IRS says you can only contribute up to so much per year. That number is increasing for 2020 by $50 for individual coverage. So it's going from $3,500 in 2019 to $3,550 in 2020. And then for family, it's going from $7,000 in 2019 to $7,100 in 2020. There will continue to be a $1,000 catch-up amount for anybody that's age 55 and older, and that's just to allow you to maximize your contribution into the health savings account. Because keep in mind, some people do use this account somewhat like an IRA or other retirement account because some of those penalties go away after you retire. Speaking of penalties, the penalties that I'm referring to only come into play if you use the money in the account for non-qualified expenses. So if you withdraw the cash and just spend the cash on anything that is not qualified, you will pay regular taxes plus a 20% tax penalty. So why might an HSA be the right choice for you? Typically, these types of health plans are more affordable than copay type plans. And then if you're somebody that likes to get the most out of tax advantage accounts, this is a great opportunity to do that. So it's a tax saver because you're putting aside pre-tax dollars out of your paycheck. Again, if you have any questions about the health savings account, feel free to reach out to us at the email box that is provided. So let's move on to your dental insurance on page number 7. Your dental insurance is provided to you through Guardian, and you have 2 dental plan options. The first one is the DHMO dental plan, and then the second one is the PPO dental plan. So very similar to medical insurance, DHMO is an in-network only plan, and then your PPO option is going to have some out-of-network coverage associated with the plan. A couple really important things and positive things about the DHMO is that you have copays for your dental services. So even before having the dental services performed, you know exactly what you're going to be paying for those types of services. For example, there's no charge for a lot of your preventive services. Sealants are a $10 copay, and then once you get into fillings, it's between $8 and $14. A crown is going to be approximately $250, depending on what type of crown it is. And then this plan also provides orthodontia procedures for both children and adults. So that is actually one major difference between the DHMO and the PPO. The DHMO plan does provide orthodontia, and then the PPO does not. Another really handy thing about the DHMO is there is no annual max benefit. So what that means is there's really no maximum amount that the plan is going to pay on your behalf. You're simply just paying your copay amounts, and then whatever is remaining, the plan is going to provide coverage for you. Do keep in mind that the network for the DHMO plan is much narrower than the PPO plan. So you do want to make sure that you're visiting guardiananytime.com and making sure that you are going to an in-network provider, because if you go out of network on this plan, you're paying 100% of the cost. The other thing I wanted to mention about the DHMO is you must have a designated primary care dentist. So to be able to find an in-network dentist, there are some instructions at the bottom of page number 7. You will have to make sure that you look up your dentist's name to be able to find what their PCD number is. If you don't designate yourself a dentist, then one will be provided for you, and you can always change it later on. So your second plan is the PPO dental plan. This plan does provide out-of-network coverage, so you do not have to pick a primary care dentist if you don't wish to do so. This plan is great for people that know that they enjoy their dentist and they trust their dentist, and they find out their dentist maybe isn't in network with Guardian. They can still take the PPO plan, and this plan provides out-of-network coverage. So remember I mentioned the DHMO does not have an annual max benefit. This plan does, and that number is $1,500 per person on the plan. So what $1,500 represents is basically your bucket of money that the plan is going to provide and spend on you when you use the plan. So it does have also an individual and a family deductible of $50 and $150, but that deductible is waived for preventive procedures. So things like your exams, your x-rays, and teeth cleanings would be paid for at 100%, and the deductible is waived. Basic procedures are going to be things like fillings and anything periodontal related, different kinds of surgeries and root canal therapy. You would pay first your $50 deductible, and then the plan is going to pay 80%. You would pay the other 20%. Major procedures on this plan: crowns, bridges, dentures, and implants. The plan is going to pay 50% of the total cost, and you would pay the other 50%. The last nice feature that the PPO has that I wanted to make mention of is called the maximum rollover. What this program allows you to do is roll over additional monies to the following year to basically maximize your annual max benefit amount for the following year. So if within this year you do not spend more than $700 of your $1,500 maximum, you have the potential to roll over up to $500 to the following year. Now, if you end up going out of network, you can only roll over $350, but if you stay in network the entire year, you can roll over an additional $500. So if you rolled over $500, that means you'd have a total of $2,000 to start next plan year with your dental services. The most you can have in your rollover account is $1,250. And if you don't know how much you have in your rollover account, you can always call Guardian at the number listed at the top right corner of this page, or you can also register on guardiananytime.com, and it's going to show you exactly how much you have in your rollover account as of now. Keep in mind, I know I mentioned that this plan does provide out-of-network coverage. Remember, you will always get the most coverage if you stay in network. And going out of network, while the plan does provide coverage out of network, you will sometimes be balance billed if the dentist is charging more than what the maximum allowable charge is that Guardian is willing to pay. So yes, it does provide out-of-network coverage, but sometimes you might be balance billed to make up for the difference. So just keep that in mind if you're somebody that has an out-of-network dentist. Moving right along to your vision insurance coverage, which is through iMed. Your vision plan is going to cover three things: your eye exams, your glasses, which include your lenses and frames, and or your contacts. So this plan, when you're using it, you do want to make sure that you are finding providers that are part of the Insight network. So you would find that out by going to imedvision.com and then choosing the Insight network. You can see at the very top, you've got your website. If you also need assistance via the member services number, that's at the top right corner of page number 8 as well. So your eye exams are covered every 12 months at a $10 copay. Your basic lenses are also covered at a $25 copay every 12 months. And then your frames and your glasses are separate. You can get new frames every 24 months, and the benefit provides you with $130 to spend. If you end up going above that $130, you do get a 20% off discount on the balance. Now, if you're somebody that wears both contacts and eyeglasses, just make sure that you only have the plan provide you coverage for one of those per year. Contacts and eyeglasses cannot be purchased in the same year. If you just wear contacts, you can get contacts every 12 months, and the plan provides you with $130 to spend. You can use this plan out of network, but it is more of a reimbursement style plan. So what would happen is you would pay out of pocket first and then submit a claim form to be reimbursed up to a certain dollar amount. Also, I just wanted to mention some of the discounts that are associated with your iMed Vision plan. So using Sears or Target Optical, they have a program where you can pick any frame, any price for $0 out of pocket. So make sure to take advantage of that. And then also, if you wear contacts, by ordering from Contacts Direct, you get an additional $20 allowance. And those contacts obviously can be sent directly to your home. We're going to move on to your short and long-term disability coverage. So remember, short-term disability is considered voluntary, which means if you would like to enroll in the plan, then of course you would pay the premiums out of your paycheck. And then the long-term disability coverage is an employer-paid benefit, which is fantastic. So that means that ROIG pays 100% of the cost for your long-term disability. So if you're interested in short-term disability this year and maybe you've declined it before in the past, you can certainly apply for the benefit. Just make sure that you are filling out what's called the evidence of insurability form. And that's just simply a medical questionnaire that gets sent off to Guardian. And it's kind of just a pass-fail. You will be notified if you are able to enroll in the plan. Now, if you're a new hire and this is the first time you're being offered benefits, then I would certainly suggest enrolling in the short-term disability plan now, because you do not have to fill out any of those medical questions on the evidence of insurability form. So short-term disability is basically paycheck protection after you've been out of work due to an illness or an accident for at least 7 days. So the benefits are going to start on the 8th day of you being out because of an illness or an accident. And this plan is going to replace for you up to 60% of your basic weekly earnings with a max weekly benefit of $2,500 per week. Now, you can receive the short-term disability benefits for up to 12 weeks. Hopefully, you don't have to be out that long, but this plan is going to provide you with coverage for up to 12 weeks, and that's why it's considered a short-term disability plan. If you've already been on this plan for more than 12 months, You do not have to worry about the pre-existing condition exclusion. But if this is your first time enrolling on the short-term disability plan, please make sure to understand this does have a pre-existing condition exclusion, which means that in the first 12 months of being enrolled in the plan, any claims that are put in using the short-term disability plan would be subject to the pre-existing condition exclusion. The guardian would look back 3 months prior to your effective date on the plan to see if you were seen, treated for, diagnosed with, or took any prescriptions for anything regarding the claim that you've submitted. Again, this is only for people that are newly joining the plan, and it's only in the first 12 months of being enrolled on the plan. Once you've been enrolled on the plan, you don't have to worry about this piece of the policy. If you're interested in finding out how much this is going to look like for you, there are some estimated rates that you can figure out based on your income. Excuse me, and the final premium calculations will be done by Guardian. Now, the long-term disability plan, remember I mentioned it is employer paid for, so you don't have to worry about paying premiums for that. It works very similarly to the short-term disability, but obviously it lasts longer, hence the name long-term disability. So for this plan, if you're not enrolled on the short-term disability, it does have a 90-day waiting period. So you would only use this plan if you've been out of work due to an illness or an accident for at least 90 days. It still will pay you 60% of your monthly earnings up to a max monthly amount of $10,000. Now, I mentioned monthly because that is the big differentiator between short-term disability and long-term disability. So long-term is going to pay you on a monthly basis, and short-term disability is going to pay you on a weekly basis. Exactly the same as the short-term disability, for new people on the long-term disability plan, do keep in mind that there is that pre-existing condition exclusion that says any claims in the first 12 months, Guardian would do a look back of 3 months prior to the effective date to see if you're seen, treated for, diagnosed with, or took prescriptions for anything regarding that claim. If it is something pre-existing, then of course the claim would not be paid out. But once you've been on the plan for 12 months, you do not need to worry about this piece of the policy. This is that disability rate calculator that I mentioned for the short-term disability. So again, just some simple math, including what your income is, can help you determine what the per paycheck cost would look like if you wanted to enroll in the short-term disability. Now, if you're already enrolled in the short-term disability and you would like to continue being enrolled in it, then you would just keep it as is. There's no changes to the plan whatsoever. Moving on to your life and accidental death and dismemberment coverage. Again, this is through Guardian. You do have 1 times your annual salary of basic life insurance, up to $300,000 that's provided to you at no cost, and this is paid for, again, by your employer, which is fantastic. If you're looking for more life insurance than 1 times your annual salary, you can certainly enroll in the voluntary life insurance coverage, which allows you to choose what your coverage amount is going to be. Again, very similar to short-term disability. If you have never enrolled in the voluntary life insurance, then you would have to fill out an evidence of insurability to be approved for whatever the coverage amount is that you are requesting. So for employees, you can request and purchase in increments of $10,000 up to a max benefit amount of $300,000. So 10, 20, 30, 40, 50, all the way up to $300,000 of extra life insurance on top of what your employer pays for you to have. If you're married and you'd like to purchase some spouse life insurance, you can purchase it in increments of $5,000 up to $150,000, but not to exceed 50%, whatever you elect on yourself. For child coverage, you can purchase it for children aged 14 days to 26 years old, and it's a flat $10,000 amount. Again, for the voluntary life insurance, if you've never enrolled, and this is the first time that you would like to enroll, then you will fill out the evidence of insurability form. Now, for new hires, with the voluntary life insurance, you can actually elect up to the guaranteed issue amounts for both employee and spouse with no medical questions to answer whatsoever. That's only for new hires that are being offered this for the very first time. So the next page in your booklet, which is page number 12, does provide you with the monthly cost in terms of what the rate is. That darker blue box in the bottom right-hand corner does provide you with the calculation of how to figure out what your per paycheck cost would be if you wanted to purchase some additional life insurance. The rates are age banded in 5-year brackets, so your rate stays the same until you have a birthday that moves you into the next age bracket. If you are thinking of purchasing spouse life insurance, remember that the premium is based on whatever your age is as the employee. As far as the dependent children life insurance goes, keep in mind you would pay one cost, which is $1.88 per month, and each child that you insure would have the $10,000 policy amount coverage. Before we end, I did want to just mention a couple of additional services that are provided to you through some of the Guardian coverages. So this one on page number 13 is called the Guardian College Tuition Benefits Rewards Program. If you are enrolled in the dental PPO and you have already been enrolled, you are accumulating tuition rewards just by being on the dental plan. So what can you use these tuition rewards for? Well, one reward equals $1 in tuition reduction at a network of private colleges and universities that are associated with this program. So you can use those tuition rewards, which equates to dollars, and you can provide those to your children, your grandchildren, your nieces, nephews, and godchildren. So how do you get access to this? You do have to register on the website, which is www.guardian.collegetuitionbenefit.com. And then once you register, you do want to make sure that you are providing who you wish to provide those tuition rewards to. Again, it's not just children. You can provide these rewards to grandchildren, nieces, nephews, and godchildren. So each year you do receive the $2,000 tuition reward. And again, even if you haven't already registered, you are accumulating those, but it is important if you want to have access to them and you want your loved ones to be able to utilize them for tuition dollars, you do have to register on the website. Currently, there's over 380 private colleges and universities that the tuition rewards can be used for. That list is ever changing, so if you're interested in looking at what the list looks like now, certainly make sure to visit that same website so you can see which schools are there. This program doesn't cost you anything additional. The tuition rewards are being accumulated as long as you're on the dental plan, so in the event that you do have a loved one that ends up attending one of these schools, it's worth it to take advantage of the rewards that you've been accumulating. Lastly, with your Guardian services or Guardian coverages, that you have access to, you also have access to their employee assistance program, which is called Work Life Matters. So this program is a confidential, no-cost service that allows you to have access to 24/7 unlimited free telephonic consultation with EAP counselors, and you can see the number listed there in your Benefits at a Glance booklet. They can refer you to local counselors, so you also have up to 3 face-to-face sessions that are free of charge to you. If you're somebody that's just looking for some maybe support resources on their website, there's over 3,400 helpful articles on topics like wellness, different training courses, and then there's also a legal and financial center. So keep in mind, this is totally confidential. No reporting goes back to your employer about who is using this employee assistance program. There's nothing extra in terms of cost that you pay for it. It is included with your Guardian coverages. So please make use of it if you need to. So the rest of your booklet does have some important notices that are placed there for compliance purposes. Please feel free to review those. The last page does have state information for Medicaid and the contact information for each one of the Medicaid programs. Just as a reminder, the deadline to put your employee benefit changes in is going to be November 8th. So please make sure to adhere to that deadline so that we can make sure we make those changes on our end. Again, please don't hesitate to use the employee email box that we've set up for you all, and that is roigquestions@bbdaytona.com. I hope you found this presentation to be useful. Thank you so much for listening, and I hope you have a great rest of your day.